I grew up in Birmingham, Alabama. I grew up right at the time that Birmingham was finally integrating all of its school system. I had the opportunity, along with two other African American females. One was a grade ahead of us, and then there were two of us in the second grade. And we were the three African American young girls at this school. And we had to figure it out. And we did. You're growing up, you're a kid, and I wasn't fully comprehending, but I was comprehending enough that I knew and I understood that there were a lot of differences made among people in life, and that those differences influenced the options that you could take advantage of, where you could end up, how you could live your life. And you just wanted to see that change. And that's what I still see. And that's why I like what I do with my public health colleagues now, because it takes into account those socioeconomic disparities, the role that where you live plays in your health, how your access to high quality food, your access to information, how the type of education you receive really influences health and well-being. I worked with the Center for Excellence in Cancer Communication Research, and I was able to work on a project where we developed education materials that address colorectal cancer for the African American community, with a focus on diet and physical activity, and most importantly, screening. We are also working with the faith community to get evidence-based cancer information, cancer screening information out. So building those sustainable programs so that people will always be able to get up-to-date evidence-based information and know what to do to protect themselves against cancer. And that we can empower people to understand that they got to advocate for their health and well-being, for the quality of their communities, and they have to hold people who make policies and decisions accountable.